Let's continue with our coronavirus update stories as well. Chriselda Lewis is with one of the prisons in Johannesburg, and let's cross to her now, and she obviously gives us a sense with other journalists as they're talking to the Minister of Correctional Services. It gets quite interesting because they need to social distance as well. How exactly they get that right is going to be important in this briefing, Chriselda.
Well, Arabella, apologies, I'm really struggling to hear you. There are quite multiple people speaking in my ear at this moment. However, we are at the Johannesburg prison where you had the Justice and Correctional Services Minister launching the screening campaign at the country's prison. So here at what is popularly known as Johannesburg's Sun City prison, you have about 9,500 inmates here, and all of them will be screened for the coronavirus. You would know, of course, this follows one of the officials at the East London Correctional Facility testing positive for the coronavirus. I understand that the Deputy Minister of Justice and Correctional Services is there to attend to that situation together with the officials in the Eastern Cape. And one of those individuals who's also going to be screened here, and quite pertinent to the Minister, Arabella, pertains to how are you going to manage the issue of social distancing in the country's prisons. There has been an issue of overcrowding in the country's prisons. How do you then ensure that an important issue such as that is adhered to when, of course, you have overcrowding in the country's correctional facilities? Joining me now is Ephraim Mhlalose. He's been here at the Sun City prison for 17 years. He's serving a life sentence for murder. He's one of those who will benefit from this process, but he's also expressed some concern about some of their challenges here at this particular facility. Babu Mhlalose, thank you very much for agreeing to speak to us here on SABC News. First of all, do you welcome what a government has done? All of you will be screened for the coronavirus.
Yes, siyakujabulela siyakubonga ukuthi nathi asithathele ekhanda afune ukuthi asisize ugovernment yize sibona okunye kunganele kangako ngoba kunezinto ugovernment angeke akwazi ukuzilungisa njengoba usuyibekile indaba yokugcwala kwamajele. Ukugcwala kwamajele kuyinkinga sisi ngoba sikwenza konke as i-health care team yethu isitshenile ngama rules ekumele siwenze ukuze singafakeleki ngalegciwane. Maintain social distance, sigeze izandla, nasithimula sizikhave senze yonke lezi, but kunezinto ezi-impossible like sibaningi ejele sigcwele. Singayenza i-social distance nakuvuliwe ijele, but nakuvalwe ijele kuba yi-challenge for thina. And lento le yenza ukuthi sigcine sesilwa sisodwa siyama-inmate because sesinokudiscriminatana. Once umuntu akhwehlela bazwisisa sengiyamjaja bazwisisa, and immediately ngimjaja itrigger anger kuye, and nami ngifuna ukuthi ngigule ngife ngibulawe kuye, and naye akafuni ngimjaje ngithi une-corona anganayo bazwisisa, and by that time sivalele this place is congested bazwisisa. There's no way ukuthi ungaya le umonya ile sila sonke uyayibona into enjengale. So i-challenge for thina yiyo into esithusayo. One mistake ejele kuzoba i-disaster. One mistake umuntu oyi-one basivulela sikwazi ukumaintain that social distance during the day. Nabavala ma-communal cell, as I've stated before, I've been here for 17 years. Ngihlale communal cell, ngihlale single cell, 70 something, using a toilet eli-1, 2 yamatel, 1 shower. Ayibona into enjengale. Nasekuvaliwe kwenzakalani? Ngiyakhwehlela, it's winter now. Sonke sinokuphathwa imikhuhlane wena sokuthi ngiyakufakela ngiyakwada and ilidela kuphi sigcine sibambana ngezandla. Remember kusejele la anything is possible, and most of us here ejele sinamakhanda aqinile. Nawuzofuna ukuthi ubukise sesigcine sesiyala sekumele ama-official angenelele, and ama-official awikho enough, ayashota. Angeke kuma-official ayi-5 akade abantu abayi-90 something to 100 ukuthi kunama-activities mela athendela abantu athendela abantu. Inkinga kune-disaster nje kahle kahle kule department.
Babu Mhlalose, njengoba senihlelile ngaphakathi nina bensenizwile nje ngokuthi kwenzakalani ngaphandle nokuthi le coronavirus isikhona nokuthi isihlasele umphakathi kangakanani na?
Sikuzwe konke mama la kakhulu serelaya ku media kuma TV na kuma paper nasema radio. Sikuzwe konke mama okwalesifo lezi. And ingakho senza sure ukuthi yonke into abasitshena to contain this virus. It's need a collective effort. It's need a collective effort. Omunye nomunye ufuna ukuba safe. Kuzube safe nami ngibe safe. We have to adhere with the rules lawa esitshenwe wona. But for us in prison, some of the things angeke sikhona ukucomplyan ngazo. Hayi ngoba sifuna ukufa or i-situation esikuyo.
Sabang kakhulu Baba Mhlalose, Ephraim Mhlalose, just to tell you a bit of what he was saying there is one of the key issues, Arabile, that we spoke about was the issue of overcrowding in South Africa's prisons. And one of the inmates here, Ephraim Mhlalose, basically saying that he's been here for 17 years. In a single cell, you would find where he is about 70 inmates using 2 taps and a single shower. So how do you implement issues such as social or physical distancing in a place like this? The minister did admit that this is going to be a challenge for them, but they're doing everything that they possibly can to ensure that the screening process goes ahead so they're able to establish exactly what is going on. But, some of the concerns for the inmates here is how are they going to be able to comply? They're saying that they don't not want to comply. They want to comply, but how does one do that in a cell where there's about 70 inmates that are in there? If you're preaching social distancing, it's very difficult under those circumstances, in particular in prisons like here at Johannesburg's popularly known as Sun City Prison.
Chriselda Lewis, appreciate that outlook as well. Then, of course, chatting to some of the inmates as well to get a sense from them with regards to this saga and what that means for them inside. The dire situation does get a whole lot trickier as well for them inside there as well. So certainly important that the Correctional Services Department does deal with that situation.